Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. So, big day today for me. I'm going to be watching some football between the Seahawks and the Rams for the NFC Championship. But before I get to that couch, I wanted to do a video today. I've placed a lot of videos on this page about my experiences in the world of cancer, uh, between my personal experiences and knowledge. Thought I would give you a history, my history with cancer, to explain why I know what I know and why I do what I do. Um, in my family, I have had five other members who've had to deal with cancer. Originally, prior to my diagnosis, I was only aware of one other cancer survivor, and that would have been my grandmother on my maternal side. She had breast cancer prior to me being diagnosed with Hodgkin's lymphoma. She did survive that breast cancer years later, and after my Hodgkin's lymphoma, she would be diagnosed with ovarian cancer, and that would be the end of her story. Um, I was also aware of my grandfather passing away from lung cancer, a heavy smoker, and then it would be some time that I would discover that my paternal grandmother had passed away from gallbladder cancer. And then, of course, I've spoken about it before, my father passing away from complications of lung cancer. Again, also a very heavy smoker. And then, most recently, I have an uncle who was diagnosed with tongue cancer. As for me, I was diagnosed at the age of 22 back in 1988 with Hodgkin's lymphoma. Our methods back then of getting diagnosed were barbaric. They involved all kinds of surgeries and all other kinds of tests. You can look them up. I'll tell you what they are: the staging laparotomy and a lymphangiogram. Now, if there's any of you old enough who in survivorship that were ever exposed to those things back then, you'll agree with me. They were horrific to go through. And then, of course, our treatments were just as cruel, just as toxic, just as dangerous. Um, but fortunately, over the decades, and I've lived long enough to see that, they no longer use those diagnostic methods. They've modified the treatments so that they are not easier, but better to tolerate, less dangerous. Um, there's a lot better experience with surveillance as you're going through the treatments to make sure that things are progressing the way that they need to. The one thing I want to stress, obviously, with six members in one family getting hit with cancer, no, cancer is not contagious. Okay, and I can tell you that all of my family members who did have cancer, including myself, none of it was hereditary. Now, there are some cancers out there that do show some hereditary markers, um, but that you kind of have to get tested for to know if that's the case. I do know that none of my relatives who had cancer, none of that was passed on from anybody else. So, one thing I always stress is I'm not a doctor. The things you hear me talk about are from my own personal experience as a cancer patient. I do not tell anyone what they should do. I will explain what I went through. I may give some guidance on how to find information to make their decisions easier or better to understand, but I will not direct anyone what to do. Dealing with cancer diagnoses, time is always important, so you need to have the best information at your fingertips, and anybody giving you advice what not to do possibly puts that treatment plan in jeopardy and make it harder to get into remission. So that's one key difference with me, is that I don't give advice what a patient should do. Um, Obviously, I'm an advocate. I look out for other cancer patients and survivors. I've been doing it pretty much my entire survivorship of 37 years. started with a program by the American Cancer Society called Cancer Mount, which basically was a peer-to-peer support program. We were put through a training, and then cancer patients would ask to talk to somebody like them, somebody who went through cancer and went through treatments, and if they could, their specific cancer. And basically, we just offered support. We were ears for somebody to talk to and vent. Because, if you're going through cancer, it's a lot to deal with. And those outside of the person diagnosed don't always get what you're feeling. I won't know what you're going through. I'll understand it though. Only you, as the patient or survivor, knows what you guys are actually experiencing inside your body and inside your mind. But I do understand a lot what you're going through. I've also authored many articles, writing for newsletters and other publications. I've attended many conferences in cancer survivorship and other issues. And of course, I have given many survivor speeches at locations such as Relay for Life and more. My experience in cancer, obviously my own personal experience, but I've also been trained in peer-to-peer counseling. Again, that was done through the American Cancer Society. Survivorship issues. I've developed so many experiences over the years between my own health and between those of others. I literally know hundreds, if not thousands, of other long-term cancer survivors. I've also obviously, authored a book on survivorship and cancer. And I also have my own website at paulsheart.com. The last thing I want to talk about is, and it's a common thing that's said by almost everybody who's dealt with cancer, they don't want to let cancer define them. And I don't. I spend a lot of time dealing with cancer and cancer issues and cancer patients and survivors, but it doesn't define who I am. I'm clear in my life that my daughters are my world. Okay, so there is a line that has to be walked between living life after cancer and living life because of cancer. You have to balance, the things that you do in your life. If you are left like I am with some susceptibilities, like I have immunity issues, then there are some things that I can't do, and that is affected by, my cancer history. But it doesn't stop me from enjoying other things and focused on things, especially those activities that involve my daughters, like college graduations and, anything else that they do in their future. But, my thing is, I started Paul's Heart over 13 years ago on my website. I have this channel. I have a YouTube channel at Paul's Heart. I also do Instagram, Facebook, and all that other stuff. I am working on more books, so I'm not giving up advocacy anytime soon. Like I said, I'm here because I want to make a difference. I don't get paid to do TikTok creations. I have no interest in it. I do encourage anybody who watches my videos to share them, to tell other people about Paul's Heart. I want my videos to make a difference to somebody in need. And then that makes my survivorship worth it. So, until next time, go Seahawks, and I'll see you soon.